Hello friends and Assalamu alaikum. This is Fayal Kasser and you are watching my YouTube channel adore.health. So what are we gonna talk today? I'm going to talk about my COVID journey. So if you want to know my experiences and do's and don'ts during this infection, you need to watch this video till the end. So let's start. Friends, as we know that COVID virus has become a current pandemic worldwide, and it's basically an infectious disease. But most of the people infected with COVID-19 they experience mild to moderate symptoms, and they recover without requiring any special treatment. But we have some special group of people like older individuals, because the older individuals they have low immunities in their body, and by the time they get older they develop some comorbid conditions. Plus the diabetic patients have also low immune levels, and those individuals who are suffering from any acute or chronic respiratory illness, and those individuals who are suffering from any heart diseases, who are obese, who have increased level of cholesterol in their blood, so they have to be very careful about this virus. They have to take preventions as much as possible. Okay, friends, so let's talk about statistics. So, the statistics are changing day by day, but we have the data. As we know, that 62.8 million people have been infected via this virus, and this is an approximation. This is not a static data, so it is changing day by day. And 40.2 million people have been recovered, and 1.46 million people they have been died sadly via this virus, and other people they are in strict isolation. So when I talk about the symptoms, I divide the symptoms basically into two groups, the less common and the more common. The less common symptoms are the commonest, mean every individual suffers from these symptoms, and these are fever. Fever would be mild, tiredness, dry cough, loss of taste and smell. And when I talk about less common symptoms, the less common symptoms are diarrhea, nausea, vomiting, rashes, conjunctivitis, and sore throat. Some people also experience abdominal cramps. So, if I talk about my COVID journey was 1 month long, and during this period, I consumed lots of fruits, vegetables, meat, and basically, I maintained a good diet. So, a good diet is very important for good prognosis. So, use seasonal fruits because they are rich in vitamins and minerals, so you need to use the fruits. You have to drink fresh juices, and then drink a lot of water, because water is very important for the excretion of a virus from your body. And use steam. Please do remember, don't take medicated steam, take simple steam because it's good. And you can use Panadol, paracetamol twice daily, but it depends upon your condition, your tiredness, your fever. If your fever has subsided, don't take Panadol, it would be useless. Use calci tablets. They are very good because of course they are rich in calcium and vitamin C, and vitamin C is also very important. If you want to make your test negative, you need to consume vitamin C as much as possible, and take a good bed rest because this is very much needed during your isolation period. When I talk about prevention, as everyone knows, there is nothing new. You have to wash your hands by soap and water, because soap and water usage is the best. Plus, you have to wear the mask, and you should know how to wear the mask when you are infected and when you are non infected. Plus, make a social distance of 6 feet. One thing I just want to mention here, that don't rub your eyes with your hands. If you are wearing the gloves, it would be very dangerous if you touch your eyes with your glove, because your virus is gonna penetrate through your puncti towards your nose, and it will be dangerous. Then stay home and stay safe. One question which is very common is when to repeat the test. So if you are infected, if you have got tested and you get positive reports, you have to repeat the test after 14 days or 15 days, I mean after 2 weeks. And if you get still positive reports, don't panic, don't create stress. Repeat the test after a week or 10 days. I got negative after 34 days, so it's nothing to worry. You have to keep yourself calm, and you have to stay in peace, okay? And make yourself sit in the sunlight, because it will provide you good levels of vitamin D, and fresh air and fresh oxygen is also good for your body health. So it's very important to take fresh oxygen when you are infected with COVID. Okay, when I talk about friends and family, they are very important part of your life. So their protection should be your first priority. So make sure those friends and family members who were in close contact with you for past 3 to 4 days, they should also get tested for COVID, right? So isolate yourself in a separate room, and make sure no one would touch your used items. Keep them away from you for at least 15 days, or until you are symptomatic or you get asymptomatic. Your family member should wear a mask if they enter your room. So their protection is very, very necessary, and especially if older people like your grandmother or father, they are in your home, or those family members who are suffering from any respiratory illness, you need to be so much protective about those also.